Hello friends, welcome to Medical Guruji. Welcome to the fifth week of the course on basic course on antibiotics. Today we will discuss clinical uses of antibiotics, their indication for use, empirical versus definitive therapy, prophylactic use of antibiotic stewardship and rational prescribing. In the last video, we discussed about the pharmacokinetics and pharmacodynamics of the antibiotics, and now we are starting with the indications for antibiotic use when antibiotics are indicated. So antibiotics are the essential medication used to treat the infection which is caused by bacteria. Their indications are guided by the type and severity of infection, the specific pathogen involved, and the patient factors such as age, immune status, and comorbidities. So we will discuss one by one. First one is treatment of bacterial infection. First use is the treatment for the bacterial infection. Antibiotics are indicated for various infection caused by the susceptible bacteria, including in the respiratory tract infection, that is of two type, upper respiratory tract infection and lower respiratory tract infection. In the upper respiratory tract infections like streptococcal pharyngitis or sinusitis, these are treated with the penicillin, amoxicillin, or macrolides, whereas the LRTIs like pneumonia, bronchitis are managed with macrolides, fluoroquinolones, beta-lactams, and rest depend on the pathogen sensitivity or susceptibility pattern. Second condition is the UTI, urinary tract infections, commonly treated with the trimethoprim, sulfamethoxazole, nitrofurantoin, or fluoroquinolones. Third category is skin and soft tissue infections, include the cellulitis, abscesses, and wound infections. Mainly the staphylococcus and streptococcus infection are treated with penicillin, cephalosporin, and clindamycin. Fourth use is in the in treating the gastrointestinal infections like bacterial diarrhea caused by clostridioids difficile and salmonella, which are managed by with the metronidazole, vancomycin oral, or ciprofloxacin. And another gastrointestinal infection is H. pylori infection, combated with the combination therapy including clarithromycin and amoxicillin. Then fifth one is bloodstream infection, that is sepsis. Broad spectrum antibiotics such as carbapenems or piperacillin tazobactam are used until pathogen susceptibility is identified. And last category is the central nervous system infection, in which the meningitis and abscess, that is for example meningitis caused by Neisseria meningitidis or streptococcus pneumoniae, these are treated with ceftriaxone or cefotaxime, whereas the brain abscess managed with the ceftriaxone, metronidazole, or combination therapy. Second use of antibiotics is for the prophylactic use. First one, let's know what is prophylactic use of antibiotic. So the prophylactic use of antibiotic refer to the administering antimicrobial agent to prevent infection in situation where there is a high risk of bacterial contamination or infection. Unlike therapeutic use where antibiotics treat an established infection, whereas prophylaxis aims to avoid the onset of infection. There are mainly four type of prophylaxis. First one is surgical prophylaxis, in which antibiotics are administered before, during, or after surgical procedure to reduce the risk of surgical site infection, that is SSI. If you want to know about the SSI, then search in the channel page for surgical site infection. You can watch the video there. There is separate video on SSI and all other hospital acquired infections. Then second, in the surgical prophylaxis, that is used in the common in clean contaminated or contaminated surgeries, example gastrointestinal, gynecologic, or orthopedic surgeries. For example, cefazolin is a commonly used for surgical prophylaxis due to its activity against skin flora like Staphylococcus aureus. Second category is medical prophylaxis. It is used to prevent infection in patient with specific medical condition or during high risk situations. Examples include in the immunocompromised patient to prevent the opportunistic infection in the patient which undergoing chemotherapy, organ transplantation, or living with HIV or AIDS. For example, trimethoprim sulfamethoxazole is used to prevent pneumocystis jirovecii pneumonia. And to prevent the reoccurrences, prophylactic antibiotics may be used for recurrent infections such as UTIs or rheumatic fever. For example, penicillin for rheumatic heart disease prevention. Third, prophylactic use is in the endocarditis. Antibiotics are given before invasive procedures like dental work in patients with valvular heart disease or prosthetic heart valves to prevent infective endocarditis. Example, amoxicillin is commonly used. Fourth is the exposure prophylaxis. It is used to prevent the infection after exposure to specific pathogen. For example, meningococcal disease. Rifampin or ciprofloxacin is used to close contact of patient with Neisseria meningitis infection. And second is anthrax exposure. Ciprofloxacin or doxycycline is used to prophylaxis after suspected exposure. And the last is for against the TB. That is, isoniazid is used as prophylaxis for latent TB infection in high-risk individuals. So there are some guidelines for the prophylactic use. We will not discuss in the detail. We will discuss one in the one line, that is what is the appropriate timing to administer antibiotic. So these should be administered within optimal time frame, for example 30 to 60 minutes before surgical incision for a maximum effectiveness. And the prophylactic course typically involves is typically short, which minimize the risk of resistance or adverse effects. Example, single dose prophylaxis for surgeries. Then narrow spectrum antibiotics must be used whenever possible, and used to target the likely pathogen without affecting broader microbiota. So there are some advantages of prophylactic antibiotics. For example, these prevent infection in the high risk scenarios and reduce the complication from the surgical procedure. Also protect vulnerable population from the opportunistic infection. And the risk and limitations are, first one is the main concern is the antibiotic resistance, which overuse of the prophylactic antibiotic can promote resistance. Then side effect or allergic reaction may occur, and the prolonged use can disturb the normal microbial flora. So the prophylactic use of antibiotic is a valuable tool in infection prevention, but require careful consideration and adherence to the guidelines to maximize benefits and minimize the risk of prophylaxis. Now we will discuss the empirical and the definitive therapy. So empirical therapy, we already discussed in short in the brief in the third week video. So we will now discuss in the detail. Empirical therapy refer to the initiation of treatment based on the clinical judgment when the specific causative organism is not yet identified. It means simple, when a patient came to an clinician and the clinician is not sure about the organism causing the disease, then the empirical therapy is started. It is guided by the likely pathogens causing the infection and local antimicrobial resistance pattern. It is used in severe or life-threatening infections, for example, sepsis, meningitis, where immediate treatment is critical, and another it is used while awaiting laboratory results such as culture and sensitivity reports. So the broad spectrum antibiotics are often used to cover a wide range of potential pathogens, which relies on the knowledge of the patient history, of infection, and the regional microbiology trends. Advantage of empirical therapy, that it provide early intervention, potentially saving the lives in critical situation, and disadvantage is the risk of overuse or misuse of antibiotic, which lead to the antibiotic resistance. And second disadvantage is it may disrupt the normal microbiota unnecessarily. Now, what is definitive therapy? Definitive therapy is the treatment which is initiated after identifying the causative pathogen through the culture and sensitivity test. Antibiotic selection is based on the pathogen susceptibility profile. It is used once laboratory result confirm the specific organism and its antibiotic sensitivities, and to de-escalate from broad spectrum empirical therapy to targeted therapy. It is used. Then the characteristics are the narrow. The narrow spectrum antibiotics are preferred to specifically target the identified pathogen, and it also reduces unnecessary exposure to the broad spectrum agents. Which minimize the risk of resistant development and reduce the side effect and disruption of microbiota. Mainly disadvantage is delayed initiation if used at first approach without initial empirical therapy. Key difference in the empirical and definitive therapies are: first one is the timing. Timing is empirical is given before the pathogen identification and definitive is after the identification and confirmation of sensitivity. Then spectrum of antibiotic in the empirical therapy, broad spectrum are used, and whereas in the definitive narrow spectrums are used. Third one is the basis, that is empirical is based on the clinical judgment and likely pathogen, and definitive is guided by the lab results and susceptibility test. Then risk of resistance is higher in the empirical therapy, whereas lower in the definitive therapy. Typically, empirical therapy is started immediately in the critical cases to control the infection, followed by a transition to definitive therapy once lab results are available. This approach balances rapid intervention with targeted precision. Then specific indication for certain antibiotics like vancomycin is used for MRSA infection and Clostridium difficile colitis. Then macrolides indicated for atypical pathogens like Legionella, Chlamydia, and Mycoplasma in the respiratory infection. Then rifampin used for TB and in combination therapy to prevent resistance. So lastly, we will discuss today lastly topic is the antibiotic stewardship and rational prescribing. Antibiotic stewardship and rational prescribing are critical strategies which aim to optimize the use of antibiotic and to combat infection effectively, to reduce the adverse effect and minimize the development of AMR, that is antimicrobial resistance. So what is antibiotic stewardship? Antibiotic stewardship is refer to the coordinated efforts to promote the appropriate use of antibiotics. This includes the prescribing of the right antibiotic at the correct dose for the appropriate duration and for the specific infection and patient needs. Goals of the stewardship are to optimize the patient outcomes, ensure the best clinical outcome for patient by effectively treating infection with most suitable antibiotics, and to reduce the antimicrobial resistance by limit unnecessary or inappropriate antibiotic use to slow down the emergence and spread of resistant bacteria. And third one is to minimize the side effect, that is reduce the risk of antibiotic related toxicity, secondary infections like Clostridium difficile, and disruption of the microbiota. And fourth one is cost effectiveness, that is the prevent unnecessary healthcare expenditure due to prolonged treatments, complication, or resistance associated with cost. Then key strategies in the antibiotic stewardship are empirical to definitive therapy. Start with broad spectrum if necessary, then switch off to narrow spectrum once lab results identify the pathogen. De-escalate or discontinue or modify antibiotic when culture and sensitivity result allow. Then use evidence-based guidelines to determine the shortest effective treatment duration. Then train the healthcare professionals on the importance of stewardship and provide access to update guidelines. Use audits to review prescribing practices and provide constructive feedback to prescribers. So lastly, we will discuss what is rational prescribing. So rational prescribing is referred to the use of antibiotics in responsible evidence-based manner to maximize the therapeutic benefits while minimize risk and resistance. So what are the principles of rational prescribing? First one is the right diagnosis. You should confirm that the infection is bacterial and assess whether antibiotics are genuinely needed. Example, exclude viral infection. Second is the selection of antibiotic. Choose antibiotic based on the likely pathogen, site of infection, and patient-specific factor like allergies, renal, hepatic function, etc. Third is the doses and the route should be appropriate. Prescribe the correct dose and choose the route of administration, oral or intravenous, based on the severity and patient condition. Avoid prolonged courses. Follow guidelines to prevent unnecessary exposure. Use affordable options with similar efficacy when possible to reduce the financial burden on the patient. The importance of stewardship and rational prescribing is that is misuse and overuse of antibiotic drive antimicrobial resistance, which render some infection untreatable. Then it safeguard the future generation, that is rational and judicious use preserve antibiotics for future generation. Third use is improving the patient care. It reduce the side effects, secondary infection and treatment failures. And last is reducing healthcare burden, that is prevent longer hospital stays and associated costs due to complication or resistance related treatment failures. So antimicrobial stewardship and rational prescribing are essential component of modern healthcare, ensuring that antibiotics remain effective while protecting patient and society at large. So in summary, we discussed from the four concepts, that is empirical versus definitive therapy. Then we discussed the prophylactic use of antibiotic, then the antibiotic stewardship, and lastly we described the rational prescribing. In short, these strategies emphasize careful selection, timing, and monitoring of antibiotics to maximize benefit and combat antimicrobial resistance. So this was all about the today week. In the next week, we will discuss about the adverse effect of antibiotics. If you like the video and the content, then please do share and subscribe our channel. You are not watching the video full, so it will make it difficult for you to understand the concept. Watch the video till end. Thank you.